Good morning, America. Good morning, everybody. This is Scott Shot, and this podcast is about Medicare. Medicare, Medicare. It's such a joke. People, I've fallen off three high structures in my life and became fully disabled as a carpenter. I have they declared me disabled and gave me Medicare. All right, here we go. I retired with a little bit of money, but I'm on Medicare. I'm on Medicare because I'm classified as fully disabled at the age of 58. After all these years of being all jacked up, busted up, 13 surgeries, I'm having a lot of issues. One of the issues is I have low testosterone. So they've been giving me testosterone shots for the last year. The medical specialty clinic in Gridley, California has been giving me testosterone shots for the last year. Well, I don't know if you know about testosterone shots if you have low T, but they're very dangerous for your body. Unless they're given for certain reasons. Well, they don't know what the reasons are. They don't know why I have low testosterone, but they've been giving me these testosterone shots twice a month. All right, I worked all my life over the table, and I retired all right, even though I became disabled because I made good money. But I have Medicare. Medicare is an insurance for your health, for older people and for people that are disabled. For 4 to 6 months now, somewhere in that area, I've been waiting to see a urologist to find out the underlying reason why I have to have testosterone shots. Because testosterone shots are very harmful to you if you don't need them for a certain reason. Well, I've been getting testosterone shots now for almost a year or over a year, and no, and they put in a referral for me to get to see a urologist to find out the underlying reasons why I need testosterone. Man, our country's all messed up, people. I'm on Medicare for being disabled. They cannot find one doctor anywhere in my area that will take me. No urologist that will take me because I have Medicare. So that basically means I have no insurance. If I can't find a provider, if I can't find a provider for urology because I have Medicare, that means you have no insurance. Testosterone shots for people. They have all these commercials on TV that say boost your testosterone and she'll like it too. Well, testosterone is a dangerous thing, people. If you don't have natural testosterone levels to where you have to go get testosterone shots, that is deadly and dangerous to the person getting them if they don't have an underlying reason to have those testosterone shots. Or they so basically, I've been getting a bunch of dangerous shots from the Medical Specialty Center in Gridley, California, for testosterone health. I cannot get into any urologist here in California, in Northern California. I can't see any urologist for trying to figure out why I have low testosterone. I've been through a lot of major accidents. I've had a lot of major injuries, a lot of surgeries, and that probably has to do with a lot of it. But but that clinic told me that these shots, after a long time, they told me they were dangerous. They didn't tell me that at first. They told me that these are dangerous for you. And we're going to refer you to a urologist. It's been 4 to 6 months now. I have not seen a urologist. 4 to 6 months in that area there. That's after they've been giving me for a year. And the other doctors act like it was no big deal, but it is a big deal. Because testosterone shots are not healthy if they're not for a certain reason. So I called them up today and I'm like, where is this referral going? And they act like I'm being an asshole because I'm bitching about it because they've been giving me testosterone shots now for a year or longer. Wow. Medicare and our federal government, they fucking suck. I mean, Medicare is insurance for people that are elderly and people that become disabled. But what kind of insurance policy doesn't allow somebody or can't figure out a way for somebody who's on that to see a urologist? It's a specialty doctor. A lot of people see urologists every day. But I can't get to find one in my area because I'm on Medicare, I worked my whole life in this country, and I got to buy a private insurance in order to go see a basic urologist to find out why I'm getting deadly shots that could kill me. I just got off the phone with one of the nurses at Medical Specialty Center in Gridley, California, and they can't tell me. All they said was, after me being an asshole and calling them and whining and bitching, where's the urologist at? They finally tell me that we can't find anybody that will accept your insurance. My insurance is Medicare. Wow. I mean, and I'm the asshole for asking them what is really going on finally. What is really going on with Medicare? Medicare doesn't cover shit, people. Our government would like you to think that old people and people that get hurt on the job where you paid taxes for, they want you to think that's and you become disabled. They want you to think that Medicare is good insurance. Medicare is shit insurance across the board, whether you are injured on the job or you're elderly and you worked your whole life and you became retired. That is my point. Medicare sucks. And we have to do something about it. I don't want to kill no CEO from no company like that retard did. I want to know what's going on with Medicare. Why can't an old person or a person who paid into taxes their whole life as an old person or as a person who got hurt on the job, why can't we get competent, reliable health insurance? That's what I'm saying. It's not Obamacare. Obamacare is as bad as Medicare. You know, it's weird, people. People have better insurance that are on Medicaid because they're poor or on welfare than a person who works their whole life, becomes retired or gets hurt on the job, and they get Medicare. They have better insurance than we ever did. I mean, people that are on disability or on Medicare for old age, Medicare is shit insurance, plain and simple across the board. It's garbage. Nobody takes it. I'm a perfect example of it. I'm telling you right now. People do not take, a lot of doctors and urologists obviously don't take patients anymore that are on Medicare. Isn't that a shame? You work your whole life and become old after they tax your ass your whole life to get Medicare, and they can't find a provider in the area, or you became disabled because you were working on a job site above the board, not under the table, not working for free. You were working over the table and you got hurt, and when you get hurt, they classify you as disabled, and you can't get insurance. I've been fighting with Medicare now and my doctors for months about the prescriptions the scripts I'm supposed to get. It's been over 4 months, between 4 and 6 months. And I just called them. They don't know what's going on. They finally copped up to it when I bitched it up, when I had to be an asshole. And I don't like being an asshole. I don't like calling somebody on the phone and bitching at some little nurse who has nothing to do with it about what's going on with my health. I mean, luckily she didn't hang up on me and she listened to all my concerns. What is going on with this country anymore, people? When we got illegal immigrants coming over here, illegal aliens coming over here and getting better insurance than I got after I busted my ass in this country my whole life. I got hurt on the job and they classified me as fully disabled and gave me a pension. I mean, what is wrong with that picture? What did all those taxes that I paid for, they came out of my checks, what benefits am I getting out of it? When it comes to Medicare, I'm telling you right now, people, this is how many benefits I got from Medicare. Zero. When it comes to my real health and if I'm going to die or not from shots that shouldn't be given unless you've been diagnosed for a reason to get those shots, they're giving them to you. So I had to stop taking my testosterone shots because they're dangerous, because my provider couldn't call me on their own and tell me that your insurance, we can't find anybody in the area to cover that Medicare. I had to call them, and I had to be an asshole for a half an hour before they finally told me the truth. Before they were finally truthful. And that goes to the Democratic and the Republican Party. Both of them. Why did I work so hard my whole life paying taxes, and then I retire? I become disabled, so I'm retired. And they tell me I have health care through Medicare, but I don't really have health care. If I can't provide, if they can't pay enough to get me a provider in that area or within 500 miles of me, then what was it for? Why did they take that money out of my check? If they can't guarantee that I will be given health insurance no matter where I live in the United States of America. Wow. Isn't that something to fucking be crazy about? Isn't that something that's whacked? I mean, and I don't care what president's in office. I don't care if it's a Republican or Democrat. It never gets any better when it comes to people on Medicare. Whether it's old age Medicare or somebody got hurt on the job, working over the table, and they got hurt from some weird way, and then they become disabled, and then they go on Medicare. Medicare sucks, people. Medicare in this country sucks. For old people, for disabled people, it just does. But they give away all this free money to everybody. They give free money to illegal immigrants. They give free money to everybody. Countries that hate us. Wow. So here I am. I'm going to die. I'm an American citizen. I'm going to die because the health system of this country for people that are on Medicare is failing. It's failing me. It's failing your family members that are disabled. It's failing your parents that became old and retired. It's a failure. Obamacare is a failure. Medicare is a failure. If I can't get the health care that I need in a timely manner to where I don't die, I'm only 58 years old. I don't want to die yet. I don't want to die yet. I worked my whole life over the table for Medicare when I get older or disabled, and then it's not there for me. It's not. I just had to pay for my script again when it's supposed to be covered under Medicare. I'm not talking an opioid. I'm talking a script for my high blood pressure. I had to pay for it. And I got the money to pay for it, but I shouldn't have to. 6 months ago, it wasn't paid for. It was paid for, but now it's not paid for because they can't even send in the right paperwork to make sure it's paid for. For all you young people coming up, for all those old people that are here dealing with it, I hope you understand that we need to hold our government accountable no matter if they're Democrat or Republican when it comes to money that's taken out of our paychecks in order to help us out later on in life, and then it's not there. The help's not there. It's a basic urologist, and I can't get in to see one right now because they won't take Medicare. I don't blame the doctor. I blame Medicare. I blame our federal government. How else do you look at it? I mean, I got to call and be an asshole to some nice young lady on the phone who doesn't even know what's going on because she just works there. But it's all just a clusterfuck. You get what? Everything about our Medicare system is a clusterfuck, and they do that purposely. Either you want to cover people that paid into this country their whole life, or you don't. I just want our government. It's like I told the girl on the phone. Either cover it or don't, and let me know what's going on. I had to call them 6 months since I was supposed to be referred to a urologist. I had to call them in order to hear that they told me after I called them, bitch, they told me, well, we just can't find nobody because of Medicare. But they didn't willingly just call me and tell me that so I could try to find another avenue to get my health care taken care of. I can afford it, but I can't afford it if they can't even tell me that they're not covering it. That is how suspect and how corrupt this government is and the Medicare system of our country. That is Scott in a shot, and I'm out of here, people. Question your government, your local, your city, your state, your federal government about Medicare because you will all be old someday if you're not already, and you will be wondering where your tax dollars went that was supposed to give you health care when you either retired or you got injured on the job. That's all I'm saying. Question it, people, because it's not getting done. It's not getting done no matter what Joe Biden says or Donald Trump. The Medicare system in this country sucks. For people that work their whole lives in this country, got taxed their whole lives, and for people that got taxed and got hurt on the job, became disabled because they're carpenters, roofers, they're welders, people that do jobs that are dangerous, that people get hurt on, like me. I was a carpenter. I got hurt because I built houses and skyscrapers for people that can't build themselves. And I got hurt because it's a dangerous job. And I can't get medical coverage that I paid into. I mean, really, that is what's going on in this country, people. This is Scott in a shot, schooling you people and letting you know that our government never has our back when it comes to insurance or Medicare. No matter what they say, we're getting effed. We're getting effed out because they don't give a shit about us. It makes you wonder why we pay taxes. It makes you wonder why we pay taxes when the only taxes that matter to me are if I pay taxes into insurance that I can't get when it's time to get them. You know what I'm saying? This is Scott the Shot, and I'm out of here. Scott the Great. Think about what I'm saying, people. You will be old someday if you're not already, and you need to make sure that they're taking money out of your check for something you're supposed to get later on that you actually get that service.